Question 30. Which of the following is the most likely cause of her symptoms? And just skimming through these answer choices, we see a lot of repro in here. 41-year-old woman presents with 9 months of irregular spotting between periods. So 9 months of irregular spotting. 9 months of irregular spotting between periods, and she's 41 years old. Age definitely matters in these repro questions. Heavier than usual menstrual flow. Cycles are regular, that's important, but now last 8 to 9 days with persistent light bleeding at the end. No pain, no bloating, pelvic exam is normal, so that's important. Pregnancy test is negative, always important to get a pregnancy test. Transvaginal ultrasound shows a well-defined hyperechoic endometrial lesion measuring 1.2 centimeters with no distortion of the uterine contour. No distortion in the uterine contour. And the endometrial stripe is normal for a cycle. So this is one of those questions where they ask us, like, what is the uterine mass? I see these questions all the time. Uterine lesions, uterine masses tend to either distort the uterine contour or not. In other words, if your uterus is supposed to look like this, but it looks like this, that's a distorted uterine contour. Maybe you have some huge masses all over the place, like fibroids. Fibroids tend to do that. Since we don't have a distorted uterine contour, it's probably not fibroids. So that would be leiomyoma and fibroids, same thing. We're still going to go through these though, just to make sure. But let's talk about the endometrial hyperplasia. If you had hyperplasia of the endometrium, your endometrial stripe would not be normal. It would be enhanced. It would be larger than normal. So because of that, we're going to cross that one off. Adenomyosis is when the endometrium essentially invades the myometrium. So if this red line is the endometrium, and then this red line represents the serosal layer, so the kind of the fibrous layer sitting on top of the uterus, and then everything in between is going to be your muscle. We'll line the endometrium here with this black here, just so you can see better what I'm talking about. This black outline is the endometrium. In adenomyosis, it tends to seed into the myometrium, and this tends to be painful and causes diffuse enlargement of the endometrium. Note, diffuse does not mean asymmetric. It just means the whole thing is getting bigger. It gets bigger, gets boggy, kind of squishy feeling, but is not asymmetric. You're not going to feel some abnormal mass on the left side that's not on the right, like you could with a leiomyoma. So this could definitely cause hemorrhage, but again, it tends to be painful, and she does not have pain. So we've been able to narrow down endometrial polyp. Let's just confirm that. Come over here to my elaborate drawing. I've drawn some different fibroids and a polyp here. So we have an intramural and a subserosal fibroid. So the blue represents our outer layers here. On the actual external surface of the uterus, you have the serosa, and so that's what this blue represents. And so you can have a subserosal leiomyoma, represented by our big meatball here, and then the black spaghetti is our myometrium. So these leiomyomata come from the myometrium. They're essentially muscular tumors. This one just grows outwards, and so it's probably not going to be able to bleed anyways, at least not cause bleeding through the vaginal canal. So we could probably also rule out our subserosal fibroid because of that reason too. Not to mention, we don't have a distorted uterus as they describe. Then we have our submucosal leiomyoma here. So the submucosa would be this layer. And then if you want to draw the endometrium, it would be like this, right on top of our submucosa. So again, you've got these layers to the uterus, and it's important to know these because it'll help you distinguish what type of mass they're talking about. So this meatball is growing into the uterine cavity. This one definitely can bleed. Then we have our intramural fibroid. It's kind of the in-between, between our two extremes, the subserosal versus the submucosal. It's right in the middle. This one can also bleed and cause bleeding. Finally, we have our endometrial polyp. This one, pay attention to the submucosa that I outlined here in blue. This one is beyond the submucosa. It's part of the endometrium itself. So this one absolutely bleeds. They're usually pretty small, like a centimeter, maybe 2, and they're painless. And because they're small, they don't distort the uterine cavity. So probably not any of our leiomyomas, again, just because of this uterine contour being symmetrical. Then we have a small lesion, and they even tell you that it's an endometrial lesion, which is exactly what an endometrial polyp is. Painless, vaginal bleeding. Uterine masses are super high yield. Please add these to Anki, or hopefully it makes sense now. So the correct answer is C.